The kind of key things we discussed were, again, that kind of treatment paradigm. I think there was broad agreement that that's how one would treat people. Dr. Eunice requires some convincing, I think, that cytarabine is the key drug in mantle cell lymphoma. I think the panel generally felt it was. I don't think there's any argument around the role of rituximab, about the early use of ibrutinib or any BTK inhibitor. Some conversation about what one should do with that P53 mutated group of patients. I'm talking specifically about young patients here, where my view is that you should consider an upfront allogeneic stem cell transplant rather than an autologous stem cell transplant. I think, again, most of us tended to agree with that. That's a very small number of patients, of course. And then the relative roles of these new drugs and moving them frontline. I think there's a general consensus that in mantle cell lymphoma, unlike the other lymphomas, there's going to be a pretty clear shift towards a chemo-free world relatively soon as we see emerging data, particularly combinations. Ibrutinib, venetoclax looks to be the most exciting of those.